Everybody, welcome to Speak Up Monday, episode number 360 here at Tropical Nomad. Round of applause. Yeah, that's right. So as you may know, we're here every Monday. It's free to come, right? So you can come and join us. In person is better. We have a wonderful studio audience which really want to meet each other and to hang out and to connect, to network, to get to know each other. That's what you're missing out on by doing the online thing and being lazy, unless you're overseas, right? So once a month, we do this very special collaboration with my good friend Tracey G from Health Hub Bali, and I'll get into what that means in a second. So we call this the Future of Health, Conversations That Matter, 2023, and this is the 13th installment. So about a year and a half ago, when I got together with Tracy, I said, hey, Tracy, we need to do something regular, and we need to bring it to the people, right? And that's where this collaboration was born. And I'm so happy to say that we've done it. And if you want to check the YouTube library, just go Robert Ian Bonnick or Speak Up Monday in YouTube, and you'll find the playlist for Speak Up Monday. But this is key. We started off with, why is it that we're living longer, but the quality of our life is diminished, right? Why is that? We've been through all of that. Each week we have a panel of experts that this week they're about to introduce themselves to give you the information so you can make better decisions. And Health Hub Bali has 3 different aspects to it. One is it's a source of incredible latest information. Tracy has the fortune, but she's earned it to be connected to some of the best practitioners of health globally. And she brings that knowledge and information to that platform. And by the way, Fridays, go check out the health market here in Pereiranan, go Health Hub Bali, 8 a.m. to 2 p.m., where you can meet some of these beautiful people here, talk to them, interact with them, and so on. So that's very important. The second aspect of Health Hub Bali is, how do we create this health journey where people can claim their own health, right? So it's a bit like this. You come, you get tested. Baselines matter. We've been through that. And what then happens is that you are then prescribed a health journey unique to you, which gives you the opportunity to reclaim your own health, functional medicine at the core of it. The third part of it is a certification body, which means that the practitioners that you're seeing are certified, which is coming online very, very soon. It's been 8 to 10 years of work from Tracy, and we're so happy to make this a reality. And that's probably enough for me for this point. So what I'd like to do is to have the panel introduce themselves, spend a couple of minutes so you get the idea and the understanding of who they are, why they're here, and what they have to say. So we'll start off with the new guy, as we called him earlier on, Denis. Please feel free to, Dr. Denis, please feel free to introduce yourself. Thank you.
Thank you, Robert. My name is Denis. I'm originally from Russia. I came here several months ago, and my background is a clinical pharmacologist. Back in Russia, I used to treat the complicated cases of pharmacotherapy. It's like nosocomial infection and treatment of infections in pregnancy and so on. But nowadays we have a team of professionals here in Bali that help a community to get medical service of local doctors. So we kind of a team which provide medical service, but not ourselves, but with local Indonesian medical institutions. Okay. I very appreciate Tracy, that you invited me here today to meet you great guys and be a part of this talk.
Denis, thank you very much. Thank you very much indeed. So we pass it to Ricky, or Phil, whichever one. Oh, look, they're going to have a debate which one should take it first.
Ladies
These
first.
guys are tight.
Hi, everyone. My name is Ricky. Originally, I came from Jakarta. I used to work in several hospitals in Jakarta. And about a year and a half ago, just after COVID, I actually started studying about functional medicine. And I find it fascinating because it explores not just the symptoms of disease, but to find the root cause of it. So I was intrigued that basically functional medicine is like probably like the future of health. And I was drawn to Bali actually because I feel that Bali has a healing aspect to it. So last year, me and my wife, we decided that we need to explore whether we can move to Bali or not. And then, now we're here. And as of last month, I'm also a part of one of the hospital chain in Bali, the Kasih Ibu Hospital in Bali. So I'm currently there as the VP of Business Development. And one of my main areas is to develop the functional medicine, or we call it here the Integrative Medicine Center in Kasih Ibu. And we already have a wellness resort in Tabanan, which later on probably we'll talk about it. Yeah, thank you so much.
Welcome. And before you pass on to Phil, so Kasih Ibu, just to put everybody in the frame, is the oldest private hospital, I think 33 or 30 years, in Bali.
Yeah. They've been here since... No, actually, it's much longer than that.
Yeah, even longer.
Even longer.
Rian lied to us. So good. And look, the other thing I want you to quickly talk into is your experience, because you've just mentioned the last year since COVID, but just give us a quick rounded insight the last 5-10 years, because you've been in this,
Okay, so over the last 6-7 years, we've seen a development in terms of functional medicine practitioners, especially in Jakarta. There's already 150 doctors joined together in an association. But the funny thing is, Bali doesn't have one. Bali doesn't have a functional medicine doctor practicing here. So that's why, first time I met with Tracey, it's like, oh wow, there's one. there's actually, now I notice that there's a lot actually, but they're just, everywhere, spread everywhere, and they're not connected to a network. So I think that's what draws me to Tracey, to Health Hub Bali, because Health Hub Bali is trying to connect all these dots, all these bits and pieces to make sure that, the future of health, or we call it the whole health, the awareness is there and people can experience it firsthand.
Wonderful. Thank you, Ricky. And over to you, Phil.
Hi, I'm Phil. I'm also the new guy, so Denis. I feel you, man. I'm sweating as well. Just the lights, I'm not too sure. I basically help people reverse symptoms of autoimmune conditions. Now, it's quite an interesting journey because I used to be a financial planner. Talk about money, okay? Wow. But then most people got to get their insurances and they couldn't get covered because their blood work wasn't good. So for me, it's like, well, let me just look at this blood work, because I knew a bit about health because I actually lost a brother to cancer. So it was my whole journey, always researching some stuff. And basically I said, well, that's going wrong. Don't tell anybody I told you what to do. Do this for 5 months and come back. And we reapply for your bloods. And most guys got their cover. So finance was great, a lot of money, I loved it. But you know what? My passion was actually want to help the humans with their health. Because I actually ended up getting 2 autoimmune diseases and got frustrated with certain people couldn't help me. So I said, hold on, I'm the best person to test things in my own body. So I started experimenting. I won't tell you what came out of me, but lots of weird things. And I reversed one of my autoimmune conditions, and then later on I got another one, and again got frustrated and just started going down this rabbit hole, and basically just moved from being in finance to now helping people reverse symptoms of autoimmune diseases. And there's heaps more fun, because if you haven't got your health back on track, life sucks. So yeah.
we'll go to Tracey. Denis, if you give that microphone to Tracey. The interesting part I find about your story is that it's funny how life sometimes keeps pushing you in a certain direction. You might try and fight the other way, like swim upstream, but ultimately it's like, well, we gave you one autoimmune disease, you learned it, we'll give you another one. Are you getting it yet? This is what you should be doing. Interesting. So Tracey, over to you, a little intro on you before you jump into that. Yeah.
All right, okay. My name's Tracey G. I've been here in Bali for about a decade, and actually prior to coming to Bali, I'd already set up something to connect people to better health in Australia. But coming here is a place I call, well, we'll go further into today, beyond the diagnosis. Part 2 is today, and we will explore other facets of it and what is real healing. But what I'd like to say, part of the infrastructure of Health Hub is we need hospitals, centres, clinics and doctors that understand whole health. They've already understand physiology, they understand how the body functions, but connecting to them what can actually heal. There's certain gaps in their training. In the past panels we've had, say Dr. Reshi pointed out for the last 330 years, medicine hasn't changed, the model of medicine, the Cartesian model, it's all separated. So now with the intellect and I guess technology, there's so much information there that we can all start owning our own health, but under the guide of our healthcare practitioners. And that's why we've invited Denis here today, and he's also part of a Russian team, whether they be dentists, obstetricians or movement specialists. They too can give information that we might need when we do go to practitioners here or centres in Bali and Indonesia. So we've got Ricky here who's also getting the structure here in Bali and connecting the legal side to in Jakarta, that we can bring a level and standard of care in the hospitals. And with this exchange of knowledge, ones like which we'll go into more detail with Denis, the diseases we can actually pick up in hospital, doesn't matter where we are in the world. We can start trialling different programs, and that's the idea of Health Hub. We start piloting things. And of course we've got Phil here, real life stories and practical things. Here's amazing results with people with any health issues. After we've done all the testing, we'll go into what a diagnosis is. There's people like him that can guide us to better health.
Before you pass it back to Denis, there we go. So let's get into tonight's episode. So as we know, this is Beyond the Diagnosis, Part 2. Part 1, feel free to seek online. Incredible information. But let's move on from there. So Tracey, so you've given us a little intro into what we're going to talk about tonight, but maybe we start with the first question. Maybe, like what is a diagnosis, and we go from there.
Yeah. So what I'd probably like is for Dr. Denis to say, because he also watched the last panel and saw some little gaps in the conversation from a professional's perspective. So would you like to share?
Yeah. Thank you, Tracey. Tracey asked me to tell some words about the future medicine and how my vision about the future of medicine. And I thought that our past, our near past, the 20th century, is the golden age of evidence-based medicine. So we knew what are the clinical trials, and we learned that we can measure the effect of some treatment, of certain treatment, without so-called placebo effect. And so it was the age of evidence-based medicine. When came the 21st age, the next stage, I think today is the age of personalized medicine, because there are cases, certain cases that we don't need the decision for everyone. So one size don't fit all. And we need to some sophisticated approach to the patient, maybe to use some genetics of the patient or kinetics of the drugs that we use. And I think the future of the medicine is, of course, a developing of evidence-based medicine and personalized approach, but also to get back to this equation the placebo effect that we subtracted in the 20th century. We got to make our mind, our brain to heal the body and to get the additional additional help from it, because our body can sure heal itself. So I think we can add it to the allopathic medicine and get the great result from it.
Great. And look, just to make sure our studio audience are with us, everybody knows what placebo effect is? Yeah, just raise your hands if you know what placebo effect is. Great. Raise your hands if you don't. It's okay. Yeah, great. Someone explain placebo effect. Yeah.
Yeah, placebo effect, it's like the effect of the mind think that the body get the treatment, and the treatment is from the kind of a drug or some operation or etc. But to measure the effect of the drug, we must get an kind of a clinical trial, and to get the placebo, like the drug without effect to one group and the drug with effect to another, and then compare the results to measure the effect of the new drug.
All right.
Sorry, my English is not very good.
Yeah, all right. So just real quick, just to give a second opinion as well, maybe Ricky, placebo effect, and then we'll go back to you, Denis, on diagnosis.
So in layman terms, I think placebo effect is like this. You give one person the real drug, then the other one is just a powder something, but then both are cured. So one is placebo in a way, because he's being given a fake drug, but still cured. It's like the power of suggestion. So it's the clinical trials is to check for that, whether it's placebo, actually the drug doesn't work, because you give a person the real drug and the fake drug and both cured.
Thank you.
In a way.
Got it?
Right.
All right, so Tracey's saying, ask Denis about what is a diagnosis? Yeah, and then after that, we'll get you off the hot spot and we'll flip it to Phil. So over to you, Dr. Denis.
What is about diagnosis? Yes, I heard the previous talk about that guy. I forgot his name. He told us about his wife who was passed away because of the cancer, and it's really a tragedy. I think there's some aspects about it, and first, of course, it's early diagnostic, and of course we must be aware of cancer ourselves, and we must diagnose ourselves and get the early diagnostic about this. And the second part is the partnership between the doctor and the patient, and it's really important to get such partnership because we need that the patient clearly understands what the doctor says to him. So to follow all the recommendation and to express all his feelings, so the doctor can use these symptoms to diagnose, get the right diagnosis.
So Tracey, if we add, thanks Dr. Denis. So if we just add, I know you've got something to say about that. So if you add a little bit more to what Denis was saying.
Yeah, probably, yeah, when the diagnosis happens, sometimes the patient, how can I say, where I'm from, it's very quick. there's just certain protocols with a diagnosis. The radiologists, right from that stage, they get scared nearly of a cancer diagnosis. But what I'd like the patients to understand is the percentages, what they actually have. Do they have cancer? What type of cancer? What's the rate of it? And all these type of questions. There's many questions that they need to ask, and I will go into that about personal responsibility in this as well.
So then maybe if we can introduce Tracey, this, we're talking about the options, the pathways for people, patients can take. So which person would you like to select that question for? Ricky? So maybe ask him the question in a different way.
Yeah, what pathways and options there are
For diagnosis
after what is a diagnosis and
okay.
what options?
Okay, so let me try to answer it. In normal, in conventional healthcare, basically, when you go to meet a doctor, basically you are asked what is your past medical history, what are the symptoms you're experiencing, and some doctors will ask you to do a lab test or a radiology test, so that then the doctor, with his knowledge, then checks for everything, and then if the findings match a certain criteria, then okay, this is the diagnosis. That is also the basis for insurance normally. That's the standard, right? So after that, then what? For conventional medicine, it's like, okay, so if this patient has this kind of symptoms, then these are the therapy or treatment or drugs to prescribe to have the symptoms removed. That's the normal things that happen. So if we are talking about functional medicine, it's a bit different because symptoms, if you cure, for example, you take paracetamol to cure your headache. Yes, the headache will go away, but probably tomorrow it will come back because the underlying condition is probably not the headache. It's something else. There's a root cause for every symptoms or illness. So this is where it's different between going to conventional doctor and to functional medicine doctor. The funny thing is, can I share a bit of story? So, yeah, because I just joined Kasih Ibu, I spent time with the senior doctors first. I want to have a feel of what senior doctor in Bali is like. So I met with this senior OBGYN, and I shared about functional medicine. And the funny thing is, he mentioned like, that's what we need actually. We need functional medicine here in the hospital. And he shared a story because he used to deal with endometriosis. There's a lot of female having that, and also PCOS. I think a lot of female patients, and it's somewhat is genetic, and it's also, he mentioned that it's sort of like autoimmune condition. So he mentioned that, normally those that came with endometriosis have other symptoms similar to autoimmune condition. Not just that, but there are several instances where patients come with depression, with mental health issues. Some patients got bipolar disorder that comes along with the endometriosis. He shared one story about a patient that has, I think it's digestive issues as well. So because digestive issues, then he then referred this patient to see a digestive surgeon. So what happened is, then the surgeon does a surgery on the patient, but it doesn't remove the it removes the symptoms for a while, but then the symptom came back. So this doctor, he said, I didn't know about functional medicine, but I have experience from my study abroad that basically we can do like food intolerance testing. So he ordered that for the patient, and it turns out the patient is intolerant to certain food. And when the food is removed from the diet, then the symptoms is gone. So I was like, so the surgery is doing nothing? It's doing nothing for the patient. The one that works is actually the diet. So I think talking about what are the pathways is, I think these are, it would have been much nicer and much more efficient if doctors can check all of this first before they do any kind of treatment. Because sometimes lifestyle changes can cure, really cure, so the symptoms won't appear again.
Thank you, Ricky. I mean, Phil, same question for you, because you would have been across alternate pathways that maybe weren't the well-trodden ones. Maybe share a story to give people an insight into how you see this.
With autoimmune, we've always been told it starts in the gut. That's a common thing. Now, I don't know if anybody has heard of leaky gut, or they call it intestinal permeability, the scientific word behind it. Now, as we age, most people are going to get gut issues. You could be 20 years old, you feel fine, you're still eating the foods that you think are healthy. And what's happening, it's like, let's say wheat, for example, is like scratching the gut, and gluten, what have you. And our body doesn't really understand it. Depending if you're eating gluten from Italy, they process it differently. So you can eat all day, it doesn't bother you. Anywhere else is processed differently. So that scratches the gut, and the gut now, it's young, it can heal it, easy, right? But now, as you get older, as you go, hold on, I've had that pizza, getting bloatedness. Then you start getting IBS and all these other things going on because the gut can't heal itself. So when you get leaky gut, you get leaky liver and leaky brain. And that's where I always say, if you can heal the gut, you can pretty much start looking at the other areas will heal itself. Think of, I like this example, Bruce Lee. He had a good, strong set of abs, but his arms weren't that big. But his core was powerful. The rest of the body can heal itself. So I don't look at conditions, I look at body systems. So if you understand the body system, whether it's the skin or the gut or the skeletal system, either way, I always start there. And you mentioned about depression, and there's what's really, really interesting. It's a big thing. It's a pandemic, depression, whether you're stuck at home or locked in the house with all that's been going on. Now, with depression, with autoimmune, it's a common thing where people have this. So if you look back further and you look at inflammation, when we have inflammation, it's linked back to depression. Now, think about this. And so your serotonin's made in the gut. Okay, serotonin's a happy hormone. My son would say, well, you're depressed, take some happy pills. That's why you need the doctors. Because if you can't function, well, take the tablets. But there is a way you can come off them eventually. So when your gut's healthy, you produce something called serotonin. And this is really interesting. This is the only thing you remember today. It's awesome. Serotonin is a pro-anti-inflammatory, meaning it helps reduce inflammation. Make sense? So in the world today, you're either driven here on a motorbike, you smell some fumes, well, that's free radical damage. It's going to cause some form of inflammation. You're stressed out, you've got deadlines, you've got financial things going, you're in a relationship that's not happy, whatever, you're walking on eggshells. That causes inflammation. So now inflammation markers go up, your gut's not healthy, well, it can't deal with it. Now we have an inflamed mind, and what you got, you start getting depression. It's common. So when you look at autoimmune, if your mind is inflamed, your body's inflamed, you're going to have something going on. It's a matter of time. I mean, I can talk all day because I'm known as talky talk, but essentially, that's what they call me. Essentially, in anyone with autoimmune has some form of depression because their body's inflamed. And if you want to go a bit sciencey, there's websites you can go to as pubmed.gov, pubmed.gov, and there's a little link there. It talks about NIH, which is the National Institute of Health. They will tell you that 14 out of 15 health issues are linked back to inflammation. Getting the diagnosis, 100%. Now let's deal with inflammation.
Great, Phil. If I can pass it to Tracey, maybe Denis, if you grab that mic there. Thank you. So just before we move on, by the way, in about 15 minutes, you're going to have a chance to have questions. So if you do have a question, just keep a mental note of it. So you've heard, Tracey, about these alternate pathways from Dr. Denis, from Ricky, from Phil. And what comes up for you, perhaps linking it back to Health Hub Bali, and also what you think connects all of these things that we've been talking about?
All right. So now we've we have doctors here. When something's wrong, as a rule, people go to a doctor. That's who they trust. So we need testing. Why we use the doctors is diagnosis. And there's I say plethora. There's so many tests now with science. The future of medicine is part of it. And out of Europe, these machines are coming here. So we can test the bone density. We can test all. You can rattle them off. But not just one. We want to find the pathway. We find what's causing the disease and remove that. What's feeding the disease. Then connecting and working as a team. Like you said, with Dr. Denis, he's got a team of doctors he's working with. We had a lady the other day just as a concierge service, what to do, and it was mainly a psychological problem more than anything else. So then that's something to deal with. But if there's a pathogen, that means something like a virus, a fungi, a mould, a parasite. First of all, we want that cleared. So there's easy ways to do that don't affect. If we need to use, pharmaceuticals, well then we have to make sure that's right. So then you have the expertise of people like Dr. Denis. And that's what's uplifting here in Indonesia and Bali. Because as a rule, Balinese would like to do it. I would say the doctors, they would like to do it naturally. And that's why emotionally, when I've shown them mapping of health and the certain tools and how they didn't know that existed because they were only taught the pharmaceutical way. But they went into medicine because they wanted to help people get better. And so that's what the platform of Health Hub. We're connecting this, and like we said before, with there's pathways that with autoimmune disease, with ones like Phil, that we can introduce to the retreats that are here and give the advice and funnel them to the right people.
And you know what? Health Hub Bali is also, it's a tourism initiative, a health tourism initiative, right? So this is kind of where another root, another leg that it stands on. Okay, great. So we've got the idea now of what a diagnosis is. We've got the idea of some pathways to health that maybe are not the ones that you've heard before. And you also have an idea now of functional medicine. This is my own personal interpretation, might be slightly incorrect, but whatever the functional, whatever the root is, whether it's mind, body, spirit, that's what functional medicine is actually about, getting to the core of it. And in some cases it would be mental issues, some cases it would be body issues, some cases it would be something else. But that's the whole point about functional medicine. So, next question, Tracey. I can see it's brewing in your head. Next question, and who would you like to direct it to?
So, it's beyond the diagnosis. What happens when there are no options? What would you say?
I think it's a very complicated situation, and of course, everybody should decide it personally what to do. I think that as a professional, every doctor should offer something to the patient. Of course, there is some palliative care. We can't treat the patient, and we must ease the pain. We should make the last days of the patient come, and the patient should pass away in dignity, and I think that's one of the ways. The other way is, of course, some innovative, maybe medicines, pharmaceuticals, or maybe clinical trials of some drugs which are innovative and are not presented at the time at the market, but they can heal the patients. I myself was an investigator for many years in clinical trials, and I saw that new medicines can heal the patients, and there were large benefits for the patients in taking part in clinical trials. So I think it is.
Thank you. And then maybe Ricky, same question. You're going to ask what the question is.
Okay.
No, it's not.
So,
We're good.
okay. So I think for me, prevention is actually it's doable. It's doable. We can prevent actually chronic illnesses. It's because I think the WHO is calling it the lifestyle related disease or something. So it's lifestyle. The key answer is actually lifestyle. So before you are diagnosed with something by a doctor, for example, there's cancer, diabetes. It's good if you have an understanding before that happens, and you can prevent it with lifestyle changes. That's why I'm currently working with Health Hub Bali as well. For Kasih Ibu, I sort of like try to get them to understand, and they are keen. They are keen. So in Kasih Ibu, we are now developing medical wellness retreat. So it's a bit different than the normal wellness retreat. Normal wellness retreat is just like, okay, detox, right? It's always about detox. But what are the baseline? What kind of detox that you need? What kind of minerals or heavy metals that you have? What kind of inflammation? It has to have a baseline from your lab test, from your radiology, or probably something like endoscopy. So it has to have a medical baseline before you went into the detox. So it's like personalized detox program, and also the education part will come where you should know about, like insulin resistance, should know about leaky gut, what is SIBO, what is IBS, IBD. There's a lot of things, and these are the things that for hospital like Kasih Ibu, this is the future of healthcare, and Bali is the one that can provide. I tried in Jakarta. We tried already talking to the specialist, but unfortunately, probably it's kind of difficult. But here, I'm very optimistic because, doctors here are they are kind and they are open-minded as well. So I believe this is something, it's not the end, Even when you are diagnosed with, for example, autoimmune, I think with the way our genetics and our environment that we lived in every day, autoimmune is not like 50, 75 years ago where, only one or two experience it. Nowadays, everyone can have it. And it's, if you don't have the knowledge, if you don't know that it's preventable disease, it's hard. But even if you have it, even if you are diagnosed with it, you can, with lifestyle changes, you can sort of like reverse the condition, right? Yeah, so I think I'm prone to the more optimistic approach that, we can do something about it. We have to try.
And so before we go to Phil, we can pass it. So we've got one more question, then we're going to go to you with the questions, right? So we don't always want to be just going one way, right? It needs to be two ways, right? That's why you're here as a studio audience, right? So just checking to see where everyone is. So please raise your hand if you have been to the hospital in the last 6 months. Any hospital, raise your hand. Last 6 months. Okay, good. Raise your hand if you believe that you would seek a medical solution over an alternate solution. Raise your hand. Okay. So then, I love that. You kind of, over here is like half and half. I like it, thank you. So the next one is then, who would seek an alternate solution over a medical solution? Raise your hand. Yeah, so it's the majority of people. Interesting. Thank you. Phil, over to you. Then we've got one last question, and we're going to go to these guys for questions.
It's all about data. And that's why I think we need the medical professionals. We have to have that. That we have to work, we can call it Eastern and Western medicine. Have you look at it? It has to work together like hand in glove. If we come along and say, oh, doctors or whatever, it's like, hold on a second. If I break my arm, give me all the morphine, man, I will take that all day. Trust me. I'm not going to take some cherries or berries that are going to take away the pain. I want the morphine. So we need the doctors. So there's a lot of people that are out there saying, oh, it's like, no. Stop the bus. You need it. So once you know the diagnosis is, with the data, the bloods, all that stuff there is lifestyle changes you can do. And someone said to me the other day, go alternative. It means you've got to do the work. Go to the doctor, give you a tablet. Which one's easier? So when you go alternative, it is work. And lifestyle changes, like you said, you've got to do them. Yeah. So when people come to me with autoimmune, I just look at the body system. Once I establish what it is, off we go. But there's a key thing, and I'll talk about, let's talk about MS, for example. There we go. That's a nice, easy one. One of the first people I helped with was MS, and all she wanted to do was have a baby. That's all she wanted. And when we actually established the body system, we actually worked out there's an acid in the brain. It's called quinolinic acid. It damages the myelin sheath. Now, if you don't know what the myelin sheath is, put your arm out like that. That's an axle. And the grease on the axle is the myelin sheath, and it keeps the wheel spinning. So if I threw some sand on the grease, it's going to grind it up and damage it. Well, it's easy. You just with a motor vehicle, just replace the axle and off you go. But in the brain, you can't do that. So when you actually get the body alkaline and you break through the blood-brain barrier by getting the body alkaline, it basically pulls the quinolinic acid out the brain because it causes demyelination, breaks down the myelin sheath. And what's interesting, it's a body system thing. Now, any health challenge mentally, let's say, I suppose I can say that. Think of MS, Bell's palsy, autism, or we can't say autism, we can say neurodivergent. All that stuff is all linked to, even motor neuron disease, is linked to demyelination. That's the body system. Get that? We're done. And you can actually help the person with those likes of those conditions. So you've got to chase the condition, then you've got to look at the body system. So you need the diagnosis. So yeah.
Great to see. Each week, so I'm not a health professional, don't pretend to be, but what I learn when I sit on these sorts of panels, I learn something every time. And you know, for most people here, probably in the audience, maybe some of you are health practitioners, maybe you're not, but what we like to do as well is to, you know, what can we do, what can we take home with us practically and do, right? And get some kind of result. And that's part of what this is about, which I want to go into very shortly. But before we go to the questions, remember, if you have a question, don't worry, you're going to be coming back for more afterwards, don't worry, mate. There's a few things he wants to say, and we're going to give him that chance later on. For the second show, show number 3 will all be all Phil. Ask Phil, there you go.
The 2 new guys.
I know, we're going to do it. So, Tracey, before we go to questions, you know, bring together a little bit from what was just said, and then after that, we'll take the mic from Phil, and we'll put it over there in the audience for people to ask questions, okay?
Okay, so we went beyond the diagnosis. When there are no options, what next? You answered that very well. It talked about death and dying nicely. But the thing is, close to death is what we call inflammation, what Phil was talking about. I've seen you remove inflammation, there's no pain. Instead of needing all this morphine, like you said, I've had someone with $6 worth of morphine. They had pancreatic cancer, one of the worst painful situations, but remove everything, the body was healing, things that hadn't been healed for, say, 30 years. On the last week, because I should go pancreatic, they live 2 days or 8 weeks to the most, as a rule. But we were able to reverse all that. But the point is the person didn't want to live. There was a psychological problem that we found out close to the end. So we use other modalities to help that side of it, whether it be EDMR and the psychosomatic work as well, and then work with the enzymes and all the different pathways, and gradually we can bring life back into the body. So when we talk about whole health, we're talking about inherently connecting to ourselves to heal. We get the diagnosis, but apart from that, when the doctors say, well, we can't do anything, and we've had cases like that, I'm saying, wherever you are, come to Bali. They've said you had 2 months to live. What is there to lose? And that can be an automatic reset. And creating spaces and places with medics here It could be the last resort, where it can be palliative care and hospice, but in a beautiful way instead of a sterile environment or at home, and we can support life. And in this case, we've seen reversals. So we mainly want to find out what at the root, what is feeding it, and switch things. And that's another conversation to be had.
So while we go to questions, so Sister IU, where are you? Or if she's not here, we'll grab the third mic from Phil, and we'll take that around to the audience. Just Phil, just give to Guzman. Yeah? Yes, okay. All right, he'll go under. Thank you very much indeed. So, as we've said tonight, I'd love the panel, after we do this Q&A here, is, what nugget, right? What could you give people to walk away from tonight, which they can go home and they can do, right? That will give them some idea about what we're talking about tonight. And I know what Tracey's going to say about testing, and that's okay. But let's do that. I'd be interested to know from each of you, what you're facing, what you're dealing with, and what people can do, right? But we'll get to that afterwards. So, audience, if anyone has any questions, raise your hand. Let's see. Okay, just behind you, Brother Guzman. Yeah, great. We'll get the questions going. Oh, by the way, when it comes to the question, so we have Phil, put your hand up. Ricky, put your hand up. Dr. Denis, put your hand up. Tracey, put your hand up. Rob, put your hand up. But you're not going to have a question for me. So just target a person that you would like to answer the question, right? That way we can be efficient with questions. So over to you. Thank you very much. It might take a while to get your microphone working, but just try it. Just speak. Yeah.
Hey everyone, my name's Tom. I'm from New Zealand.
Kiwis in the house. We've got one over here. Love it. Thank you.
I guess it's kind of a question for everyone, but I'll probably direct it at Tracey. So I'm just interested to know how much of a role do you think intuition plays in healing?
With when we say the body holds the score, and even like as an advocate or a navigator for people, I say you actually know. You already know what you need, but there's information. You haven't had the extra 10 years to study that subject. So when we're going to the experts and getting the data and the information, we need their expertise. They need to understand where we're coming from, and that can guide us to make that decision. And feeling into that, not forced or out of fear making decisions. So when we're talking beyond the diagnosis, when you do go there and they want to say put chemotherapy for 6 months and 35 lots of radiation, we're saying, well, what other options are there? And having that, because you either feel right about it, and some people do feel right, and that's that. But if not, I'm saying click into that, always.
Got a feeling that Phil wants to say something about that. I got you there, brother. So before Phil does, we had a beautiful man on the show. I keep mentioning, Tracey knows who I'm going to mention. So his name is Balinese fella, right? Fella sound like New Zealand, you see. I've got the Kiwi in me, the Kiwi. So basically, Professor Gelgel Wirasuta. So Professor Gelgel Wirasuta, he is the advisor to the governor of Bali for traditional Balinese medicine and traditional Balinese wellness. And the question, Tom, that you mentioned, I asked him the same thing in a different way. I said, look, Professor Gelgel, and he's a toxicologist background, so he's a scientist as well, right? So I asked him, in your opinion, what is one of the most causal factors for health in the body, right? What would you say that is? Now, I was expecting, right, Balinese background, he's going to come with a Balinese approach. I'll be happy to hear it. Love Bali, we all do. But he surprised me, but not Tracey. He surprised me. He said, Rob, one of the most important factors for health is your thoughts. It's the way you think. And the thoughts cause illness in the body. And I was like, whoa. So there's a little one for you there before we go to Phil.
Yeah, 100%. I still believe, people to use this word called trauma. I just say you had a bad event in your life, and that can actually cause you to get sick later on. And sometimes people with autoimmune, it's like having an identity. Hey, my name is Phil. I've got psoriasis. Who are you when you don't have that? Yeah. And they sit there and go, oh, they're stuck in the story. And many times I say to somebody, do you want to find a way to heal it or not? And they go, I don't know. I said, when you find out, come talk to me. because I don't want to work with that person. Because if they're stuck in their identity, you don't want to do that. Because then you just basically just, utilize them for financial gain. It's not cool. But intuition, 100%. You have to, they know 99% of the time that it's either for them or not. And I want to just say one thing from the medical professionals is that people will come to you as a health coach or an alternative person, and I'll say this again, East and West come together. If they're having to do with chemo, someone will say, oh, that's bad, don't go to those guys. I was like, hold on, what do you think? What do you feel? Stop thinking, start feeling. And they go, you know what, I think I need to do that and what you're doing. There we go. That's your path. Like we said, we make it individualized. That's important, so yeah.
So Tracey wants to quickly interject, and then we'll go on to the next question.
Intuition. Every moment, some scientists would say every second there's 100,000 mechanisms or things happening inside this factory. That's why functional medicine, something's blocked it. What's unblocked it? Let's bring the life back into it. And because the modern diseases, they are modern diseases, we need modern solutions sometimes. That's why we go to medicine as well. Yeah. But the homeostatic, the self-regulating system's always there. And this autoimmune thing is when it's trying too hard and it's tipped over. So that's where we need to neutralise that and bring it back.
So another question, anybody? Yeah, just over here. Thank you very much. By the way, a great friend, Dr. Sujata, PhD out of the US, we have 74,000 thoughts a day. 74,000 thoughts a day. That's what she said. I'm just going to pass it on. There you go. 74,000. God.
Thank you. Okay, so my question is, after the initial testing gets done, let's say blood work, heavy metals, is the process after that a pyramid where these are the things to first look at? That's always diet, that's always oxygen levels, something, and then it goes here, then here? Because in the alternative medicine space, there's the acupuncturists who think that they've got the cure for everything, and then the diet people who are like, it's all about this, and the inflammation people are, oh, it's all about this. So I'm just wondering if it's like a tossed salad and you just throw all the solutions at once and see what sticks, or if it's this level, this level, this level.
Love it. Great question. Tracey.
After me, okay. Yep. So there's an art to healing, and it's about you. So it can be, depending on your history, on many different issues, different ways. But yeah, it's very personalised, and that's why we've got navigators. You have the menu there, you get your testing, and then you start creating that. And the way you respond to it, sometimes there'll be a block if you don't clear this other part. So it's like a parallel thing. It's not going here, here, here. We do it like together in some ways, yeah. And that's the idea of doing like a solid 10 days. These retreats that we're piloting at the moment is the idea to use detox, yes, clear what's there so we can actually see what's happening, because often we've got so much blocking, and then to reset and restore so that we can bring the life back and you can actually function as yourself.
Amazing, thank you.
Did you say you wanted to pass it to Denis after?
No, I don't
No? You're right?
No, you've got something to say.
If you have, it's okay. If not, it's okay.
Okay. I think it's from allopathic medicine. You just need to know the background, the symptoms, and we have an expression that we are not treating the labs. We treating the patient. And so we must personalize it and to make the right diagnosis out of all the picture about the symptoms, about the background, about medication that patient already have take. And after that, you make the right diagnosis and prescribe the treatment from the guidelines, from the evidence-based. So on.
Great question. Thank you very much. Now, does anyone else have a question? Yes. And we have another one. Yeah, go. Please. Yes, it's okay. It's okay. Yeah. And then we'll go to Carol after, and that will be the last question. Yes, over to you.
Sure. Okay, so my question was, is the best case scenario for a client that wants to consider alternative medicine to be able to plug themselves into a unit, basically, of different practitioners so that they can view this person as one person and kind of knock out anything that's going to be a waste of time and then create a protocol together? And is that what you're envisioning for clients?
Yeah. Ricky? Yeah.
Thank you so much for the question. I think that's a very good and very tough questions actually, because I think it's true that there needs to be a certain protocol. For example, like for health coaches, right? We work based on goals. Right? There needs to be a certain goals. If we were to work, for example, with a functional medicine doctor, then when the doctor, you mentioned about, for example, heavy metals, and then inflammation marker, and then there are other tools as well. For example, we have the gastrointestinal mapping, for example, to test for the bacterial in your digestive, whether the microbiome is sufficient or not, whether there's pathogen or not. And then we have the intestinal permeability test to test whether you have a leaky gut or not. So there are a lot of these kind of tests, including the OA, organic acid test. Those tests are available basically in Bali. Not many people are aware of that yet, as of yet. But I think with this baseline, yes, there needs to be a common understanding between practitioners. Because, for example, if you go to acupuncturist, they will just check your pulse, or they will just check your eye, and they say that, oh, you have a liver issue. We had that in Jakarta. So we had a facility, we had a hotel back in Jakarta. I was working in a hospital group that owns a hotel and a functional medicine clinic as well. So we tried to bring in everyone there, but here's the situation. So the doctor gave lab tests, then the result came out, and then the patient also meet with acupuncture specialist at that time that did a pulse testing, pulse diagnosis. So the acupuncture says that, oh, your liver is very hot, so it has issues. But the lab test shows that the liver is normal, it's within the normal range. So this kind of situation happen when you are trying to integrate between the Western and Eastern medicine. Yeah, there needs to be a common understanding that basically, yeah, we have to base on the baseline first, and then number two, when it comes to protocols, what are it goes back to, is there any evidence-based treatment to treat this kind of symptoms? For example, for acupuncture, I think in the US, if you're talking about Mayo Clinic, acupuncture works well with pain management. So it has to go through, those route. So you deal with pain, you deal with, I don't know, what else works?
Yeah. What I'd say is that sometimes people deal with the pain, but they're not dealing with the root. So they leave too much time, and in the end, they've got this huge disease that's very difficult to turn around. So that's why we start west and then we go east. And then we learn lifestyle medicine. We actually learn to live, which we should have learned when we were kids, eating. And we start owning our own health.
Wonderful. Thank you so much. Thank you. We're going to pass that microphone on to Carol over here. That'll be the last question, and then we'll go to the wrap-up after that. Don't worry, Phil. We got you, brother. We got you, mate. It's just so easy. This question goes to you.
So I'm completely trusting my intuition on asking this question because it just came out like that. I'm very interested in looking at how trauma impacts people, and I want to ask a specific question about heartache, heartbreak, and heartache. Yes. So what kind of illnesses and symptoms, but medical symptoms, have you observed as a consequence of having someone feeling a heartbreak? Because we're talking about a more holistic approach, looking at the source. So how does that manifest? And is there any research in that? And are there any typical symptoms that people can, look at? Any manifestation of that medically?
a multi-dimensional question, which we love, and we'll start with Denis. Yeah.
Okay, thank you. It's an interesting question. I think our mind can play different games, and after heartbreak, which is stress for organism, we have multiple different symptoms. Starting from the depression that is the first that comes into mind, and different kind of infection. If a person have maybe a herpes infection, it could be the acute phase after that. Also, different kinds of pneumonia. As for the stress, we can have example of the soldiers that comes to the army, and they have outbreaks of pneumonia from atypical microorganism like chlamydia, mycoplasma, that sort of thing. That's not because they live together, that's because all of them have stress situation. And as Phil already told us, I 100% for it. Stress can be that factor which starts the infection. Also, there's a number of cardiovascular diseases, and if a patient have a background of it, he can have an acute myocardial infarction, or maybe a stroke, that sort of.
So well, thank you very much, Dr. Denis. So I think, Tracey, you want to interject, or one of the other fellas? Yeah, up to you. Yeah.
So what happens is with the, when they call it metaphysical, some call it, or just the energy is held there. So with some, like you talk about the soldiers and that, there's been like a thickening around the heart, and they get this, as they get older, there's a lot of pain there, they don't know what it is. But when you listen to their story, that's what they were a prisoner of war or something, had to live on the stone, or their mum left when they were 2 as well, and it compounds all these different things. But whatever you're predisposed to, so when Denis talks about the whatever virus is there can be dormant in the body, that would come up in these situations. And that's when you can connect Chinese medicine. They'll pick up on certain emotions, are certain stuck in certain areas, with certain organs, lungs and heart. Yeah.
Yeah, you want to tag on to that one? Yeah. Yep.
Can I add a bit?
Well, yep.
So, okay, I study a bit about trauma and how the mind works, because in Jakarta I have a patient having anorexia. It's very difficult. So, talking about heartbreak or heartache, for most people, actually it doesn't cause trauma. It depends. There's this one genetic testing. We have that available now. It's called personality DNA test, where one of the traits that is, for me, it's quite dangerous. Actually, it's called OCD predisposition. OCD is obsessive compulsive disorder. So, or we call it in the normal term, it's perfectionism, mind perfectionism. For people with mind perfectionism, it's kind of difficult to deal with anything bad in their life, and it can cause trauma. So, talking about heartbreak, I have no experience whether heartbreak, turns into a disease. But what I know is, for those with genetic predisposition of OCD, for them it can be quite troublesome. When their mind cannot perceive this heartbreak situation, when they cannot process it, what happens is they become, it's like the movie is playing on and on and on and on, and it starts creating what we call the monkey mind. yes, people with, for example, with bipolar, with some sort of schizophrenia, and then anorexia, bulimic, they all normally they have sort of like, whether it's voices that talks to them, talks negative about themselves, or it's vision. So I've dealt with patients with this kind of diagnosis before, and it's really troublesome. And psychologically, the therapy should be something like CBT. It's a cognitive behavior therapy, right? In one of the CBT education, there's this model. It's called APET model. So how our mind works when dealing with traumatic situation is like this. So for example, in your childhood, you dealt with, someone break into your house, and then you are, being put in the bathroom. That time you are all alone. So it's a traumatizing situation. So when you're adult, and then, your mind is not at its best situation, and then you're alone at home. So there's this trigger. Oh, I'm alone at home. So your mind actually not remembering the trauma, but the emotion that you deal with when you had that trauma. So when that happens, you feel the fear is taking over. The A is the action or the activities or the trigger. The P is the pattern. Your brain remembers that, oh, I used to have this situation, this similar situation, and there's this pattern coming out. And then the E is the emotion. So it's not really about the trauma. It's about the emotion that you felt during that time. After the emotion, the thoughts coming in. So your negative thoughts all comes out. Then normally what you get is either panic attack or, and then it's difficult. So heartbreak may cause this when you are, when you have a ideal perfectionism mind. So for me, it's like that. So it can cause other things, but it all comes down to that. And when you have that, actually, with CBT, it can be cured. So if you have trauma, we can use like clinical psychology to deal with it. And also, there's a lot of things on the alternative side, like there's hypnotherapy. What else? We have like access bars. Yeah. So we can cure. Sorry, I'm probably rambling on.
But you know what? It was a multi-dimensional question, and she received a multi-dimensional answer from everyone, right? So flirted the rules, but it was great. And I know Phil's to come. My God, we're going to be here till tomorrow. All right, Phil, after this, you're going to get another chance, but over to you.
As a financial planner, we used to see a lot of people dealing with depression and trauma, and those are one of the biggest claims in the industry. So when someone has a trauma, and they put it down to if somebody dies, you move house, and you get divorced. 3 biggest ones. Now, they usually happen along in your life. We're going to get them somehow. But I'm a person about saying we need to deal with it. And I say to people, get over it, and that's pretty harsh. But I say we have to have tools to do this. Now, when it comes to trauma, I mean, my mom's mom passed away. 3 months later, her dad passed away. He died of a broken heart. Now, when we have that, I don't know if that's something that you're dealing with right now, and I get it, right? Is that I lost my brother, 2 of them. One to cancer about 26 years ago, and the other one literally to about, this might be challenging to talk about this, but he was actually murdered, shot in the head. But because I had tools how to manage this, I managed it through a lot easier, and I had people around me to work with that. So that's super important. You've got to have a team around you. And when we have these things happen to us, is that, number one, we don't sleep often. Well, that's the cheapest thing. It costs you nothing. Everyone's worried about some modality. Just get some sleep, take your shoes off, and take a walk in the sun. Literally, and go find some shoulder to cry on. Literally. We forget about the community around us instead of looking for protocol. So sometimes it could just be as easy as that. But definitely, it's find a team around you and go back to fundamentals, basics. Get some sleep. But we can't because our mind, like you're saying, is monkey mind. So, but when our body's stressed out, we're not sleeping, well, we get stressed out, and whatever that weakest link is in the body is going to get it. Could be rheumatoid arthritis, it could be fibromyalgia, it could be whatever. So that's why it's not the condition. So yeah, and I mean, I know you tell me often where somebody's got a lung condition, it's because maybe they haven't dealt with grief. So sometimes you've got to dive down those things as well. So yeah, hope that helps in some way.
And great question, great answers. Thank you very much. So what we're going to do now is, as we begin to wrap up, and I'll give you a little bit of pre-warning, if you like. So the last question is, so today we've spoken about, beyond the diagnosis, part 2. So you have an option. Don't choose both. Choose one, right? You have an option. You can either, we like to give practical what you just did, so maybe you choose the other option, Phil, what can we leave people here, either here, watching live or watching at home? What can you give them related to the topic that could be what you believe is valuable advice when dealing with this, right? So beyond the diagnosis, part 2. So that's one for you to mull over. If you've already done that and you're wondering what else you can do, then the other question for you would be, why is Bali, which you answered already, Ricky, for you, why is Bali the place which helps all of this that we're talking about tonight, right? How do we get beyond the diagnosis, part 2? What role does Bali have to play in that? So one of those two. So as a way to wrap up, before we go to these guys here, just want to thank everybody here, obviously, who's come live. I want to thank Tropical Nomad, our brothers and sister. We got Guzman, we got Ayu, brother Ichi as well. Thank you very much indeed. Next week, we have an AI panel. So if you're wondering about collective intelligence, what the hell is it? How does it work? Help, right? Come next week, because we've got 5 or 6 incredible experts who are able to deliver it in a way that people like me, and possibly like you, who don't know much about AI, can actually understand, right? So make sure you come next week for that. Remember also that on Friday at Health Hub Bali, so just go Health Hub Bali on whichever one, Instagram, Facebook, and so on, and look out for that Friday market where you're going to go deeper with talks like this, where you can talk directly to health professionals from 8 a.m. to 2 p.m. It's like 6 hours in there, right? Just pop down there. It's in Pereiranan, depending how you want to pronounce that, right? Pereiranan. And you can go there live. It's free, and you get some incredible information. I've been to a few of them, one of them actually, and I'm still thinking about what was discussed that day. So these are the options which are open to you. Remember it. And for those of you wondering, how do I join this? Come online, join us live. It's free. It's great. You'll see a topic that you like. Make sure you come for that, because you'll meet some great people. So now to the closing comments from each panelist. So the 2 there, right? There were 2 questions. Answer one of them. One is, is there any information by way of practical advice that you can give to people either here live or people watching online when it comes to this, beyond the diagnosis, part 2? What practical piece of advice can you give them? That's one. Or, if you've already done that, then choose to answer, well, why is Bali for you instrumental in this whole journey of beyond the diagnosis and the journey of health and reclaiming our own health, getting better and getting back to ourselves. So who want to start with? We're finished with Tracey. So the fellas, you got it. Ricky, you go next. There you go.
What do I want to say? Okay. Okay, I think I'll try to answer the practical ways, because I already choose the other, explain the other one. So yeah, again, it's not easy to change your lifestyle, especially for us Indonesian. We don't do lifestyle that much. It's just working, 8 to 5, sitting a whole day, and then eating a lot of junk food. Sorry. But it has to start. It has to start from somewhere. I think the best way to get yourself a good motivation, I agree actually with Phil. The first thing to do is get some sleep. I think that's one of the most important thing. And I know it's crazy. Sometimes it's difficult to get enough sleep. But I did a bit of study on the circadian rhythm. So it's good if you can sleep between 10 to 6 because the deep sleep goes from 11 to 1 a.m. in the morning. So if you can have like good sleep, that is one important thing. And it's Bali. It's Bali, so you have opportunity to be stress-free, in a way, stress-free. So get yourself involved in activities that brings joy to you. I think that is also one of the important things. So if you have enough sleep and you have joy in your life, everything else, then you can start. It's so much easier. Thank you.
Thank you, Brother Ricky. So one from you, Phil, and then we go to Denis, and then we go to
I
Tracey.
can't do one, mate.
I know it. I knew it.
Okay.
I knew it.
Go find somebody you love and hug them for 30 seconds or a minute. That's it. That'll break down barriers like that. And then get some sleep. But in a nutshell, I'm a big fan of reducing acid and inflammation. Get outside the sun. That actually helps alkalize your body. Take your shoes off. They're making you sick. We've all heard about grounding. Get your body in a negative state, like a battery. That's where you got to be. So touch the ground. You actually do, barefoot and pregnant. You've heard that one before? Because your body remineralizes when you're barefoot, not washing dishes. The other thing as well is really just keep it simple. Don't overcomplicate it. You actually know what the answer is. But I always say to people, and I'll give it this as the last one I'll say, when our body, think of your head as a cell. Now, to get nutrients into that cell is lymphatics. So think of us here as the ocean, we the organs, we the fish. Well, if that water's dirty, the fish are going to jump out, or they're going to die. So you need to clean up that liquid. Simple. Lymphatics actually gets nutrients into the cell. That cell, which is the round part of my head, is basically, you want to soften that cell, make it soft and squishy like a sponge, so your body can absorb nutrients. That's omega-3s, like flax seeds, chia seeds, walnuts, flaxseed oil, or walnut oil. Because omega-3s is the DNA of pretty much every single cell in your body. When that's soft and squishy like a sponge, you can absorb the nutrients, you can absorb the medications, you can absorb the supplements, whatever you're doing. And if it comes in a box, it'll put you in a box, it's another thing. So once that cell is absorbing those nutrients, you want to get the waste out of that cell. That's lymphatics work again. Fundementals, right? And that liquid around that cell is your lymphatic system. And that technically is bicarbonate of soda. It's your interstitial fluid. It's your eyes, it's your saliva, the whole lot. So if that liquid's filthy and dirty, guess what? All that stuff don't make any difference. So, and the easy way to do it, and this is the last thing I'm going to say, the quickest thing you can do to soften that cell is go make a green smoothie. We all know about green smoothies. Who uses them? Anybody? Yeah? One thing you can do, get some flax seeds, little brown buggers. Don't go and buy the ones that are already ground up, a waste of money, they've gone rancid. You want to get them and you grind them up when you need them. Those omega-3s, they pop open. Go put your greens in, chuck some water in, put a bit of fruit for flavoring, and off you go. There's your greens. We lack minerals. Not fruit. Fruit's up here on the tree. It takes a lot of effort to get something up there. Greens on the ground. So, simple thing, that's the easy thing to do with smoothies. This is what I teach all my clients. Get some greens in your body. And if it comes in a box, it'll put you in a box. It's very, very simple. Okay? And if it eyes before it died, just eat a lot less of them. That's simple.
Mate, lovely. Lovely. Thank you very much indeed. Dr. Denis? Yeah.
Yeah. It's actually a lot was said about the prophylaxis, really good things, because I like the psychiatric rhythms. It's actually the Nobel Prize for Medicine for 2017 and 2021. for circadian rhythms. Of course, we must have a lot of sleep to act very well and not to be ill. But I suppose there's one thing, because we are in Bali, we must wish something really hard, and the silent make it happen for sure. I think that's the thing for the wrap up for me.
Thank you, Dr. Denis. Appreciate you, brother. So, Tracey, over to you.
Yeah, so we're talking diagnosis tonight. Ideally, we're talking prevention. We're talking, if there is, and I say if anyone's had a diagnosis, let's reframe it. Let's call it the wake-up call. Wake up and live. And they're the type of retreats that Health Hub is growing, and to awaken that healer within, to reset and restore health. And the idea is to come here and explore it under we've got the Balinese community as well, that's medical, clinical, and very organic. We've got the whole Indonesians who have been trained worldwide and coming back to Indonesia. And Health Hub's about connecting to these and all the expats that are here, that you can get the advice you need, and then you make your choice. Because the bottom line, it's about ourselves and what we do.
Beautiful. Tracey, we'll do you last. Phil, Ricky, Dr. Denis, Tracey, thank you very much indeed. Round of applause to you, the audience. Thank you.